be significant. The most notable and common side effect tends to be constipation, but many others also experience abdominal pain, especially pain within the upper stomach. Some people find improvement in these side effects by taking the iron supplement with a little bit of food, adding additional fiber into the diet, and using that every other day dosing strategy rather than taking it every day or multiple times per day. Some people also find that side effects, particularly abdominal discomfort, are improved with the liquid formulation. And remember what I said earlier about vitamin C. You definitely want to pair your oral iron supplement with a vitamin C source as well to make sure that you're enhancing absorption as much as possible. Some oral iron supplements even come paired with a vitamin C supplement. There are also a few things that decrease the absorption of iron, and these should be avoided within 2 hours of the iron supplement to enhance absorption. This includes calcium, magnesium, caffeine, and a few different medications as well, including Pepcid or famotidine, levothyroxine or Synthroid taken for hypothyroidism, and Biktarvy, which is typically taken for HIV. Okay, so what about the people that have intolerable side effects from their oral iron supplementation or have trouble absorbing iron in their gut? Besides oral supplementation, we also have the option of IV supplementation or IV infusions of iron. Iron infusions are typically much better absorbed and increase ferritin levels quickly and dramatically. Plus, all the GI side effects can be avoided with the IV formulation. But of course, IV iron is still going to have its own set of side effects. One of the most concerning possible side effects of IV iron is the risk of a transfusion reaction. This is essentially a type of allergic reaction to some of the products found in the IV iron. Typically, these are given in outpatient infusion centers where patients can be carefully monitored and treated for these types of reactions if they do occur. Transfusion reactions are less likely to occur if you're able to split up the dosage of IV iron into a few different infusions rather than getting the whole bolus all at once. Fortunately, this type of reaction is relatively uncommon, and most people actually feel a lot better after getting their infusions. Typically, patients should repeat an iron panel or a ferritin level about 6 to 8 weeks after starting an oral iron supplement, or 4 to 6 weeks after receiving an IV infusion, to ensure that the ferritin levels are rising appropriately. And if ferritin levels are not increasing as we would expect with supplementation, then it's worthwhile to look into why that is. People with persistently low iron or ferritin, despite iron supplementation, typically fall into 2 different categories. Either they are not able to absorb the iron due to an underlying condition, things like celiac and Crohn's, or on the other hand, they might be losing iron through some sort of blood loss. This includes frequent blood donations, regular menstruation, especially heavier periods, as well as people that might have a slow and usually silent bleed throughout their GI tract. And keep in mind that iron deficiency is actually one of the most common signs of colon cancer, so definitely important to investigate.